3 years ago, a 7-year-old woman walked into my hospital for what was supposed to be a completely routine procedure. She wasn't frail. She wasn't bedridden. In fact, if you met her in the waiting room, you would have assumed she was one of the healthiest people there. She exercised regularly, remembered every detail of her medical history without notes, and still managed most of her family's finances on her own. Her children weren't worried. Her husband wasn't worried. And honestly, neither was she. The surgery itself went exactly as planned. Technically flawless. No complications. Stable heart rhythm. Stable oxygen levels. Everything looked perfect on paper. But several weeks later, her daughter called my office and said something that has stayed with me ever since. "Doctor, my mother came home alive, but she didn't come home the same." That sentence hit harder than almost anything I had heard in years of surgery. Because she was right. The woman who returned home after anesthesia was different in subtle but deeply unsettling ways. She forgot conversations she had hours earlier. She struggled to follow complex discussions. She became emotionally withdrawn, sometimes anxious for no reason, sometimes unusually irritable, not dramatically, not enough for anyone to call it a catastrophe, just enough for the people who loved her to know something had changed. And the worst part? Nobody had warned them this could happen. I'm Dr. Kevin Adewale, and after more than 2 decades inside operating rooms, there is one conversation I believe medicine still does not have, honestly enough, especially with patients over 60. Because while surgery has advanced enormously, while anesthesia is one of the greatest miracles in modern medicine, aging changes the way the human body responds to these drugs in ways many families never fully understand until it's too late. And no, I'm not talking about dramatic Hollywood scenarios where someone never wakes up from surgery. Those situations are rare. I'm talking about the quieter complications, the ones that unfold slowly, the ones families notice at dinner tables weeks later, the forgotten names, the unusual confusion, the personality shifts, the exhaustion that lingers long after the incision heals. These are the complications that rarely make headlines, but they are real. And if you are over 60 or love someone who is, you need to understand them before anyone wheels you into an operating room. Because the truth is this: a 7-year-old body does not process anesthesia the same way a 3-year-old body does. Not remotely close. And once you understand why, a lot of things begin to make sense. Let me explain something most people are never told. Anesthesia is not simply going to sleep. That's the comforting phrase hospitals use because it sounds harmless. But biologically, anesthesia is far more complex than that. These medications travel through the bloodstream, pass directly into the brain, and temporarily alter the function of the central nervous system itself. Your liver must break those drugs down. Your kidneys must clear them. Your brain must recover from them. And aging changes every one of those systems. By the time most people reach their mid-60s, liver efficiency has already declined significantly. In many adults, drug metabolism slows by 30 to 40% compared to younger patients. That means medications stay active in the body longer than expected. Now imagine 2 people receiving the exact same anesthetic dose. One is 35 years old. The other is 72. The younger body processes and clears the medication efficiently. But the older body, the drugs linger. The sedation lasts longer. Recovery becomes slower and less predictable. And it doesn't stop there. Kidney function naturally declines with age too, even in healthy adults. Many anesthetic agents, or the byproducts they leave behind, rely on the kidneys for removal. Slower clearance means prolonged exposure, and prolonged exposure increases the likelihood of confusion, disorientation, and cognitive complications afterward. But perhaps the most important change happens in the organ anesthesia affects most directly: the brain. Older brains become dramatically more sensitive to sedative medications. In fact, many seniors require far less anesthesia to achieve the same level of unconsciousness. Yet because their bodies eliminate the drugs more slowly, they often remain under the effects longer than intended. Think about alcohol for a moment. A glass of wine that barely affects a healthy 3-year-old can leave a 75-year-old dizzy or exhausted for hours. Now replace wine with powerful intravenous anesthetic drugs used during surgery. That is the physiological reality many families never hear explained clearly. And this becomes even more important when underlying health conditions, enter the picture. High blood pressure, diabetes, heart rhythm disorders, early memory decline that hasn't officially been diagnosed yet. All of these conditions quietly increase vulnerability inside the operating room. A few weeks after surgery, the daughter sat across from me with tears in her eyes and asked a question I could tell she had been carrying for days. Is my mother developing dementia? That fear is incredibly common after surgery in older adults. Families notice changes in memory, concentration, personality, or emotional stability, and immediately assume the worst. But what many people don't realize is that there is another condition, one that exists in a gray zone between normal recovery and permanent cognitive decline. It's called post-operative cognitive dysfunction. Most people have never heard the term before it affects someone they love, and yet it may be one of the most underestimated risks facing older surgical patients today. Post-operative cognitive dysfunction, often shortened to POCD, is not a stroke. It's not Alzheimer's disease. It's not technically dementia. But to families witnessing it unfold, it can look frighteningly similar. A patient who was mentally sharp before surgery suddenly becomes forgetful. They lose track of conversations. They struggle to focus while reading. Simple decisions become exhausting. Their mental processing slows down. Sometimes they repeat themselves without realizing it. Sometimes they withdraw socially because they know something feels off, even if they can't explain why. And what makes this especially difficult is how subtle it can appear in the beginning. There's no dramatic collapse, no sirens, no obvious emergency, just a slow realization that the person who came home after surgery feels different than the person who went in. Research over the last decade has shown that cognitive decline after anesthesia is far more common in older adults than most patients are ever told. Some studies suggest that between 1/4 and nearly half of adults over 60 experience measurable cognitive impairment after major surgery. In many patients, these symptoms improve over weeks or months, but not always. For some older adults, especially those over 70 or those already experiencing mild undetected memory changes, the effects can linger for a year or longer. And here's the part that deeply frustrates many families. They often know something is wrong before anyone in medicine acknowledges it. A spouse says, "He just hasn't been himself since the operation." A daughter notices her mother becoming unusually confused with finances. A son realizes his father suddenly struggles to follow conversations he once handled easily. These observations matter. Families are often the first to recognize cognitive changes because they know the patient's normal personality better than any hospital staff ever could. So why does this happen? The answer is more complicated than most people realize. Surgery itself creates an enormous inflammatory response inside the body. Even successful surgery places physical stress on every organ system. The immune system activates. Stress hormones rise. Inflammation spreads throughout the bloodstream. In younger adults, the brain usually tolerates this temporary stress remarkably well. Older brains are different. As we age, the brain becomes more vulnerable to inflammation, oxygen fluctuations, blood pressure changes, and the direct chemical effects of anesthetic agents. Researchers now believe this combination may temporarily disrupt communication between brain cells in ways that affect memory, attention, and emotional regulation. And certain patients carry even higher risk than others. People with hypertension, diabetes, sleep apnea, atrial fibrillation, prior mini-strokes, chronic inflammation, poor sleep before surgery, heavy medication use, or mild cognitive impairment that has never been formally diagnosed. In many cases, these vulnerabilities exist silently for years before surgery ever happens. Then anesthesia becomes the stress test that exposes them. I remember one retired engineer in his early 70s who underwent what should have been a straightforward procedure. Physically, his recovery was excellent. His incision healed beautifully. His heart remained stable. But cognitively, his wife noticed changes within days. He began forgetting passwords he had used for years. He lost track of appointments. He became frustrated during conversations because he couldn't process information as quickly as before. And what haunted him most was that he knew something had changed. That awareness can be emotionally devastating for patients. Imagine feeling your own mind becoming less reliable, while everyone around you tells you to just give it time. Sometimes time helps, sometimes it doesn't fully. This is why informed preparation matters so much. Because while no doctor can eliminate risk completely, there are absolutely ways to reduce it. Lower anesthetic exposure when appropriate. Avoiding certain sedative medications in vulnerable patients. Managing sleep carefully before and after surgery. Reducing unnecessary medication interactions. Monitoring oxygen and blood pressure aggressively during procedures. And perhaps most importantly, identifying high-risk patients before surgery instead of after complications appear. But cognitive decline is not the only danger older patients face under anesthesia. There is another risk that can unfold much faster, sometimes within minutes of entering the operating room. A risk involving the heart itself. And in older adults with hidden cardiovascular disease, it can turn a routine procedure into a life-threatening emergency before the surgeon eve. Here is the truth I want every family to understand before surgery ever happens. Growing older does not mean you are weak. It does not mean your body is failing, but it does mean your brain, heart, liver, and kidneys respond differently to stress than they did decades ago. And anesthesia is a major physiological stressor. That is why preparation matters so much. Ask questions before surgery. Request a detailed anesthesia discussion. Bring a complete medication list. Ask about delirium monitoring. Have a family member present during important conversations. These simple steps may dramatically reduce complications that too many patients discover only after surgery is over. Because the patients who recover best are not always the youngest or healthiest. Very often, they are the most informed. And if a doctor dismisses your concerns or rushes past your questions, do not ignore that feeling. A good medical team welcomes informed patients. They want you involved in your own care. If this video helped you, share it with someone over 60 before their next procedure. It could help them ask the right questions at the right time. And subscribe for more medically accurate health videos designed to protect you and the people you love. And makes the first incision.